After spending 4 months in the intensive care unit, a 55-year-old UAE resident has won his fight against COVID-19 at an Abu Dhabi hospital. Doctors say the Bangladeshi expat was infected with a severe strain of the virus that also caused organ failure, along with other complications. Amal Al-Jabri has more on his heroic battle.
Doctors are calling it a miracle for a man who is most likely one of the long-term COVID-19 patients in the UAE, fighting the disease while battling life-threatening complications. Experiencing severe breathing difficulties, Bangladeshi Abu Tahir Muhammad Ismail was brought in to Life Care Hospital on 8th May. A team of doctors diagnosed him with acute respiratory distress syndrome, severe pneumonia, and chronic renal failure.
Regarding this particular patient, Mr. Abu Tahir, he is a 55 years old gentleman, known diabetic and hypertension on treatment. We received this patient from LLH Hospital Musafa for suspected COVID with severe renal shutdown and anuria. He initially started conventional hemodialysis for a couple of sessions. After that, he couldn't tolerate that session, and we continued for a specialized hemodialysis procedure called continuous renal replacement therapy. We did this procedure for him for around 300 hours. That means almost 15 days. He gradually improved and his urine output gradually increased, and we slowly tapered the CRRT, continuous renal replacement therapy. And at present, he is very comfortable with the normal kidney function without any medicines.
After spending 115 days in the ICU, Ismail's case shines a light on what long-haul coronavirus patients with complications require.
This patient came to us with corona positive. He was on mechanical ventilator for 30 days, followed by 30 days of tracheostomy. With the help of the multidisciplinary team and the nurses, paramedics, physiotherapist and dietitian, now the patient is absolutely fine and he is planning for discharge. Now he can taking care of his own needs and walk without support.
As Ismail has gotten a second chance at life, his battle with COVID-19 was truly an ordeal, not only for him.
I was so sad and scared. I had no one to talk to or confide in. I can only thank the Almighty God that my father came back to us. He had been feeling very weak for more than a week and did not have an appetite. When he also began complaining of severe breathing difficulties, I took him to the hospital.
Along with mechanical ventilation, Ismail was given standard COVID-19 therapy as directed by the UAE health authorities. After nearly 4 months of ICU treatment, Ismail was discharged on 31st August. Doctors say that reinfection may occur for some COVID-19 survivors. In fact, the second bout can be even more complicated depending on how severely it affected the individual the first time. That's why it's crucial that survivors, as well as the general public, follow all safety precautions, including wearing a mask, social distancing, and sanitization, while maintaining proper nutrition, staying well hydrated, keeping fit, and avoiding crowded places. Amal Al-Jabri, Emirates News.